Okay, one more video. My name is Jessica Taddeo, and this is my video submission for week 3. I've already gone through the whole head, eyes, ears, nose, and throat, neck examination with my patient here. I did another practice, included the respiratory system. I'll go ahead and practice a little bit on the cardiovascular and abdominal areas and see how that goes. So I'm gonna wash my hands, go ahead and greet my patient. Hello, sir. I'm going to examine you today. My name is Jessica. I'm a nurse practitioner student. And I'm going to start by doing a cardiovascular examination. I'm just looking first at his neck while he's sitting here. I don't notice any jugular venous distension. I'm going to go ahead and look at his lower extremities. I don't notice any signs of edema in either. And while I'm down here, I will check his dorsalis pedal pulses, posterior tibial pulses. Good. And I'm looking at the skin for any rashes, lumps, bumps, lesions, bumps or bruises or anything like that while I'm, going through all the body systems. The skin is just kind of part of that, not doing it separately, but just sort of looking at the skin as I go through every body system. So if you could go ahead and lay down for me, sir. Put your head on this pillow here. Thank you very much. And I'm going to listen to your heart sounds, okay? I'm going to pull your shirt up though, okay? Thank you. And again, I'm looking at the chest. I'm looking for at the skin, no lesions, lumps, bumps, or bruises, or anything like that. Chest rise and fall is symmetrical, and I'm going to go ahead and listen to the heart sounds. So you can just breathe normally. You don't have to breathe like that. Aortic, pulmonic, air supply, tricuspid, mitral, all right, good. So S1 and S2 are present. I don't appreciate any murmurs or gallops. I'm going to go ahead and examine the abdomen. Again, I'm looking at the abdomen. It appears symmetrical. There's no external areas of lumps, bumps, or bruises. So inspection and then auscultation. And I'm going to listen for bowel sounds. He hasn't had breakfast yet, so his tummy's rumbling a little bit. Good. And one more. So good bowel sounds in all 4 quadrants. I'm going to go ahead and palpate your abdomen, and I'm going to do light palpation first. I'm just kind of feeling if there's any tenderness. And just go ahead and tell me if it hurts anywhere. And I'm also looking at his facial expressions to see where it hurts. Go ahead and do a little bit of a deeper palpation. Kind of feeling for any masses or anything like that. The abdomen is soft, it's not rigid or firm. Try to feel his liver. Big breath. Okay, you kind of feel the liver there. And I can percuss the abdomen. open air, you should feel something a little bit more echoey, a little bit more dull. Over the liver, solid organs. So good. And from the abdomen, we can do a genitourinary examination, which I'm not going to do on the video. And go ahead and look at his lower extremities. And I don't see any rashes, lumps, bumps, or bruises in the lower extremities and the skin. Dorsalis, pedal pulses, posterior tibial pulses are 2+ bilaterally. I'm going to listen over the vessels in his abdomen. I forgot to do that, so I should listen over the aorta. Iliac arteries, renal arteries, check for femoral pulses. Check for radial pulses. And check the carotid pulse one at a time. Good. And good. While you're here, I'll just go ahead and examine your lymph nodes again, since you're in a good position. And I need to practice them. Pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. All right. You can also palpate to see if there's any axillary lymph nodes that are swollen. What else? We can go ahead and sit up for me. Go through a quick neuro exam. We could test cranial nerve 1, which is the olfactory nerve. It's not routinely done, no complaints of problems with smells or anything like that, so we skip that. Cranial nerves 2, 3, 4, and 6. We're going to test the visual acuity, extraocular movements, visual fields, corneal reflex. We tested all that. Check cranial nerve 5, which will be the facial nerve. I'm going to have you go ahead and close your eyes tight, 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 tight. Open them. Good. Raise your eyebrows up to the sky. Scowl. Puff out your cheeks. Good. And we'll check the cranial nerve 11, which will be spinal accessory muscles. I'm going to have you shrug your shoulders. Good. And then turn your head towards my hand. Turn your head towards my other hand. Good. Push down. Good. Push up. Good. We can test sensation. And I'll go ahead and have you close your eyes. I'm going to touch you and you tell me where you feel it touching.
The cheek. My head. My cheek. My throat. My ear. My ear.
All right, good. Sensations intact bilaterally. Oh, we can go ahead and run through the HEENT quickly one more time. Head first. Inspect the head, the scalp, the skull, the facial features all appear normal, normal cephalic, atraumatic, normal head. Inspecting the skin for any lesions, lumps, bumps, or bruises. And there is one little lesion in the right posterior scalp area. It's raised. It's about 0.75 centimeters, and he's had it his whole life. The eyes, we're going to go ahead and check the external eyes, eyebrows, eyelashes, shape of the eyes, the moisture or lack thereof on the surface of the eye. We're going to look at the conjunctiva. You can just kind of pull down like that. It should be nice and pink. If he was anemic or something like that, they'd be really pale. Checking the sclera, looking for any redness, injection, or jaundice. His sclera are white. If he was jaundiced, be worried about liver failure or something like that. I'm going to go ahead and check the extraocular movements. Go ahead and I want you to look at my pen and follow it with your eyes. I'm going to make sure we go all the fields of vision up and down. Good. And I'm going to check your corneal reflex. Just kind of put that, open your eyes for me. Put that over there. You should blink. And make you blink. Good. I'm going to check your visual fields. So I'm going to have you look at my nose. And how many fingers do I have up?
One.
And how many fingers?
One.
No cheating.
One.
Okay. How many fingers do I have up?
3, 4.
And how many fingers?
2.
Okay. Good. Visual fields are intact. We can check visual acuity. I don't really need to practice that. Go ahead and there's a cat coming. We're gonna check his eyes with the ophthalmoscope, and I'm gonna take a look at the fundus, the optic disc, and go ahead and dim the lights in the room and take a look. Trying to see if there's any signs of hemorrhage. If the optic disc should be not pale or anything like that. And then we're going to look on the other side. Okay. I'm going to move on to the ears. Looking at the external ears, no signs of lesions, lumps, bumps, or bruises. Going to look at the tympanic membrane with my otoscope. And good. TM should be pearly gray. Again, this one's a little bit red, which I think is his normal scarring on his ear. Ear canal is intact. There's no impacted cerumen or anything like that. I'm going to go ahead and look in the right ear. And you do see the cone of light at 5 o'clock. You can see the malleus. Color is pearly gray. Tiny bit of cerumen. Just check the other ear if I see the cone of light. I didn't really notice it before. I think it's where the redness is, but let me see. Oh, look at that. There it is right there. Cone of light. No signs of perforation. TMs are pearly gray in color. Next is the nose. We'll check for patency of the nostril as I examine the anterior and inferior surfaces of the nose. Breathe in and out through your nostril, honey. And out. I shouldn't call my patients honey, but since he's my husband, I'll call him honey. Breathe in and out through your nose. Good. So nasal passages appear patent. I'm going to take a look inside and examine the nasal mucosa, look at the septum. Helps if I turn the light on. Nasal mucosa is pink. Septum is midline. There's no lesions, lumps, any abnormalities, no noted polyps or anything like that. And we'll go ahead and take a look at the mouth and the throat. Open your mouth, say ah. Posterior pharynx is clear. I don't see any postnasal drip running down the back of his throat. There's no exudate. He doesn't have tonsils because he's had his tonsils removed. If I notice swelling in the tonsils, I need to grade that. I'm looking at the uvula, the soft palate, the buccal mucosa. I'm looking at the tongue, the teeth, the gums, overall dentition status. I'm looking at the lips on the outside, making sure they're not cracked or dry. His are pink and moist. And I can check his gag reflex if I had a tongue depressor, make sure that's intact. And the other part of the nose is checking the sinuses. So I want to palpate the frontal sinuses, kind of just gently push up and back. Does that hurt when I push?
No.
All right, and the maxillary sinuses, and kind of gently push up and back. Does that hurt when I push?
No.
All right, so frontal and maxillary sinuses are non-tender to palpation. We can go ahead and check muscle strength. I want you to put up your dukes. All right, don't let me pull. Don't let me push. Good. All right, same. Let me see. Have you put your legs. Don't let me push your legs apart. Don't let me push your legs together. Good. And push up with your left foot. And push up with your right foot. Good. All right. Muscle strength is strong bilaterally. Go ahead and stand up for me. I'm going to have you put your feet together. Close your eyes. Put your arms out to the side. This is the Romberg test. And we're just looking for any drifting or anything like that. Good. And you can open your eyes, put your arms down, and just go ahead and take a few steps over that way for me. I can assess his gait and posture. And go ahead and walk on your tippy toes back to me. Good job. And go ahead and walk. You can turn around and walk on your heels back that way. Good. And go ahead and walk heel to toe back to me again. Good. All right, go ahead and sit down. We're going to test for ataxia. I want you to use the index finger of your right hand. Touch your nose. Touch my finger. My finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. All right. And do it with the other hand. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose, touch my finger. All right, there's no ataxia in either limb, and we'll test coordination of the lower extremities. What I want you to do is take your heel of your right leg and kind of rub it up and down the shin of your left leg. Good, and go ahead and do that again on the other side. So coordination in both the lower extremities is intact as well. That, I think, is pretty much going to conclude my hour-long videos of my physical examination of my amazing, wonderful, dedicated, supportive patient. And we'll see you next week. Thank you. Say bye.